Have you heard of orgasmolepsy before? Unfortunately for me, this is something I suffer from. Now, it doesn't happen every time, but I would say it happens the majority of the time. If I was to go on a date and meet somebody, it is something I'm going to have to mention if that date was to go any further. So what is orgasmolepsy? Is a rare condition where cataplexy is triggered, specifically by orgasm or sexual activity. Cataplexy as a symptom of narcolepsy. Cataplexy is a hallmark symptom of narcolepsy, a chronic neurological disorder that affects the brain's ability to control sleep-wake cycles. People with narcolepsy often experience disrupted nighttime sleep and an abnormal level of daytime sleepiness. Cataplexy is characterized by a sudden temporary loss of muscle tone triggered by strong emotions. Triggers of cataplexy. While cataplexy is usually triggered by emotions like laughter, surprise, fear, or anger, orgasmolepsy represents a unique trigger, sexual activity or orgasm. This indicates a strong emotional or physiological component tied to sexual responses. Prevalence and documentation. Orgasmolepsy is an extremely rare phenomenon. A study where it was observed in 3 out of 75 patients with narcolepsy and cataplexy underscores its rarity. Due to its uncommon nature, there might not be extensive research or a large number of documented cases. Presentation and diagnosis. The diagnosis of orgasmolepsy can be challenging due to its rarity and the potentially private or sensitive nature of its triggers. In my case, it was particularly notable that orgasmolepsy was the presenting symptom without accompanying daytime cataplectic events, which is atypical since cataplexy is generally associated with a range of emotional triggers and often occurs in conjunction with other narcolepsy symptoms. Treatment and management. The treatment for orgasmolepsy would likely follow the general lines of treatment for cataplexy and narcolepsy. This could include medications that help regulate sleep cycles or control cataplexy. Counseling and therapy might also be beneficial, especially considering the intimate nature of the trigger. Impact on quality of life. Given the personal and intimate trigger for cataplexy in orgasmolepsy, this condition could have significant psychological and emotional impacts. It could affect personal relationships and sexual health, making support and understanding from partners and healthcare providers crucial. In summary, orgasmolepsy is a rare and specific manifestation of cataplexy in the context of narcolepsy, where the trigger is related to sexual activity or orgasm. Its rarity and the sensitive nature of its triggers make it a particularly complex condition, both in terms of diagnosis and management. Further research and documentation are needed to better understand and treat this condition. It is quite embarrassing. Having to say, by the way, if I happen to orgasm, I might pass out for a couple of minutes. There is nothing to worry about. You don't have to call an ambulance or try and drag me out your front door. I will recover and wake up. It's a little bit of a killjoy, but it's better to be honest than it is to hope it does not happen. There have been occasions where I have not mentioned this condition due to embarrassment, and I've awoken to pure panic, slapped around the face, CPR, or I hear the words "an ambulance is on its way." I always have to just make sure that I am in a fairly safe position, preferably laying down, a little bit of planning and preparation for the countdown. If you have enjoyed this video, please like and subscribe. Visit my channel for more content like this. You're welcome to let me know your experiences in the comments below. Thank you for watching.